informing you of a chromosome defect called Klinefelter Syndrome. Klinefelter Syndrome is a male defect that is caused when the male is born with an extra X chromosome. It is also the most common genetic for male infertility. Today I'll be informing you of three major factors of the Klinefelter Syndrome that include the medical issues, the psychological issues, and also the social problems that are associated with the Klinefelter Syndrome. First, I will begin with the medical issues that are associated with the Klinefelter Syndrome. Klinefelter Syndrome can cause changes to the male's cognitive and physical development. Males with the Klinefelter Syndrome generally have longer legs, longer arms, narrow shoulders, so they're generally by age 11 you can already tell that they're much taller than their peers. Males with the Klinefelter Syndrome also can have up to 10% less IQ than the average person. So, continuing with the medical issues, mortality in the Klinefelter Syndrome is significantly increased, and the death is is enhanced with diabetes, cardiovascular, respiratory, and those kinds of sort of things, which is affected with their body type. That kind of enhances those kind of things for them. 10% of males with the Klinefelter Syndrome are also diagnosed with autism. Males with the Klinefelter Syndrome also have a higher risk of having breast cancer because during those adolescence years, during puberty, they have the chance of developing breast. Continuing on to the psychological issues, many males that are actually have the Klinefelter Syndrome typically are actually lead a normal life, and they are definitely not considered retarded by any means, but many of them do have mild learning disabilities, especially in the language-based learning system. So growing up in schools and stuff where a lot of things are language-based, it is a little bit more difficult for them to learn. Also, executive dysfunctions can be present with males that have the Klinefelter Syndrome. Continuing with the psychological issues. Like I said before, most males lead a normal life, but it has been associated with a lot of underlying emotions, including depression, sometimes schizophrenia, alcoholism, attention deficit disorder. Most of them seem fine until they come across the infertile area of their life, so that can cause a lot of depression once they realize that they can't have kids, because about 50% of people that actually have Klinefelter Syndrome don't know it until their adulthood starts, until they're actually trying to settle down and have a family, and that's when they realize. Also, the main treatment for Klinefelter Syndrome is testosterone, so that can cause a lot of aggression and depression and those kind of emotions, which a lot of researchers believe that that's why the crime rate for males with Klinefelter Syndrome is a little bit higher. It's not necessarily a proven research thing, it's just kind of something that some people believe because of the testosterone levels that they have. Continuing to the social problems, most people that have Klinefelter Syndrome have a perfectly normal life, but a lot of times the issues that they go through during adolescence years can cause a little bit of social problems. Typically, they have the behavioral problems that I was talking about before, the aggression, the depression, those kind of things, but those can also be led to diagnosis. So it's not just saying that they're depressed or saying they have aggression problems, it's actually a diagnosed depression, and those kind of behavioral problems can also lead them to realize that they have the Klinefelter Syndrome if they haven't already been diagnosed. As far as maybe when they're going through adolescence years and their parents notice that maybe they are having aggression, that leads their parents to take them to the doctor to see if there's anything actually wrong with them, and that's when they realize that they have the Klinefelter Syndrome. So, after, like I said before, their body images can have a lot of effect with their social problem, especially during the adolescence years. They have a bit more awkward body type than going through adolescence. Most people already have an awkward type, but they actually have and increased awkward tummy type. So that can lead to a lot of teasing and bullying, especially with males that are having to go into like PE classes or having to change in a public area or something like that. That can lead to a lot of teasing. So that can create social problems that, affect them for the rest of their life. At the conclusion, Klinefelter syndrome is the most common chromosome defect, which ultimately has a hard impact on males with the syndrome that continues throughout the rest of their life. I have told you guys about the medical, the